Every serious analyst out there, including the Social Security trustees, the Social Security actuary, the Congressional Budget Office, says there are going to be cuts to your Social Security check in the next few years. This is across the board. According to the law, there is no grandfathered in as well. They won't cut my check because I'm currently receiving. No, the law is that if there's only X amount of money coming in to FICA taxes, only that amount goes out. So if only 75% comes in, then only 75% goes out, and therefore everybody across the board is going to get a 25% cut. As of right now, we're looking at 2034 about a 21%. I think that's going to come down a little bit in terms of, it might be a bit sooner, 2033, and unfortunately the cut is going to go up a little bit. If the next president gets some of the things that he wants to do, there are going to be more cuts. Unfortunately, they're going to be sooner. I've got all the analyses of all the different agencies and think tanks in my YouTube description. So please check that out. But we need to be serious. Basically, we need to be serious about saving Social Security and make sure it's here for the future, to make sure we don't get cuts in the future. A lot of people, 40% of people out there depend on Social Security only. That is their only income. And we need serious people. Where do we need serious people? We need serious people in Congress. Those are the people that are going to solve or not solve this issue. So we've got 435 House of Representatives, we've got 100 senators, and we got the president. So basically a handful of people have your checks in the palm of their hand. And unfortunately, I'm seeing this way, way too often. We've got this congressperson out of Louisiana, Clay Higgins, that basically doesn't have a clue what he's talking about. So I'm going to educate him today. And he is trying to, he either doesn't have a clue what he's talking about, or he knows exactly what he's talking about. And his attempt is to destroy Social Security, make the customer service worse. He says that he's going to he wants to improve customer service and help the elderly. But I'm going to show you this video here, and actually I'm going to talk about it at the end of the video. And what he's attempting to do actually will have the opposite effect of reducing customer service, making it even worse than it is. And the ultimate goal, I would argue, is to destroy Social Security and give it over to the oligarchy, the Wall Street billionaires. There's already some proposals out there from another congressperson from his state, Louisiana. It seems like Louisiana seems to be the center of the future destruction of Social Security. So, all right, so let me go ahead and show this video, and let's talk about it on the other side. So this is Clay Higgins, representative from Louisiana. And this is he is doing the Social Security commissioner, the one that just resigned. He is testifying in front of Congress about customer service, and we all know customer service is an issue. But let's see how he addresses the issue.
Mr. Chairman, this is Social Security for 1 hour, 28 minutes, 25 seconds. Phone number 800-772-1213. It's a number for Social Security. This is what our elders have to listen to. These are our elders, my man.
I agree.
Yes, sir.
The reason they're calling, when I have a question for you, I'll ask it. That's the way this works. The reason our elders call for help is because they need help. Not because they want to listen to elevator music. They want to talk to a human being. Listen to this, America. Pay attention to what's happening to our elders. If you need in-person help, you must first make an appointment. Now you make the appointment on the telephone. You know who answers the phone? Nobody. All of our offices.
All right. So he's 100% true, 100% correct. That, yes, if you call Social Security, they don't pick up the phone. But his solution, that's the issue. So rather than actually solving the issue, he's going to make it political for another purpose. And I'll talk about that in a bit here.
And work so hard to care for our elders, and the number one complaint is that they can't get any answers or even anybody on the phone. at Social Security. It's a mischaracterization of our position, Mr. Chairman, Mr. Ranking Member, to say that we have a problem, that Republican conservatives and fiscal hawks like me have a problem with the federal employees. We have a problem with federal employees failing to perform. And we associate the failure to perform with realities that we face. You want to talk to us in person, get an appointment. You want to get an appointment, make a phone call, we don't answer the phone. That failure to perform is the issue, Mr. Chairman, Mr. Ranking Member. That's our issue with the federal government employees. And we associate it with not showing up for work through telework. So let me say that those federal employees that do not show up for work, they're going to get fired.
All right, there you go. So as soon as I heard this, I thought the old Simpsons thing. It's like, stop punching
Mr.
yourself in the
Chairman,
face. Stop punching yourself in the face.
this,
So this
this
is
is so.
basically what. Let me end this here. So okay, so he is wrong on so many levels. Okay, if you want to end telework for Social Security, okay, fine, no problem. Okay, whatever the case may be. If you don't know, my name is Ed Weir. This is also a live Q&A. After I finish talking about this, I only talked about this for a few more minutes, and then I'm going to get into the live Q&A to help make sure y'all are getting all the benefits you're eligible for. Yeah. So he is talking about the teleworking, and he said the reason people are not picking up the phone is because of telework. And I am here to speak on behalf of the 55,000 Social Security employees, which right now, as you can see this chart, numbers speak for themselves. Social Security is at a 50-year low in terms of staffing. But look at how many people are retiring. There's this thing called the baby boomers. So you got more people retiring and you got less people helping them. And who is the fault of that? Resources from Congress, from this particular person right here. He actually just gave $20 billion to retired government, a very, very small number of retired government employees, $20 billion a year for political purposes, 100% political purposes. And if he would have just given a percentage of that to the Social Security so they could actually hire people, whether they're telework or not, that's not the issue. I'll talk about why telework is not really an issue. If he just gave part of that to Social Security so they actually going to hire people to answer the phones, that would be the solution. But he decides to go ahead and make it political by talking about telework. Okay, here's the issue with telework. I ran the third business Social Security office in the country. So the whole telework thing is just a misdirection. It's a red herring that he is attempting to do to, eventually, kill Social Security and give it over to the Wall Street billionaires, his supporters. All right. So every day at Social Security, me and my staff, what we did, me and my supervisors, we came up with a schedule for the day. Okay, you're on the phones. At my desk and supervisor's desk, they can see who's answering the phones and who's not. It doesn't matter whether the person on the phones is right next in the nenext desk or whether that person is at home 10 miles away. It has zero relevance whatsoever. You're not answering the phones. Hey, why aren't you on the phone? Oh, I'm taking my break. Okay, all right. You're taking your 15-minute break in the morning, 15 making a break in the afternoon, only 30 minutes for lunch, and then obviously the day is extended to get the full 8 hours. So yeah, they right there. You're monitoring. It doesn't matter whether they're teleworking or not. If you want people to return to work, that's fine. Or return again. This is not about returning to work. They are working. They're just not working in the cubicle next to you. They're working down the line. In terms of appointments, every day, every office throughout the country, they set appointments. You call up and you want to file for disability. That employee, that claim specialist, has 6, 7, 8 disability claims to take that day. It doesn't matter whether they're in the cubicle next to you or their house 10 miles away. They have to take those disability claims. If it's a retirement, survivor's day, they're taking SSI, whatever they're taking, they have a set of appointments every single day that they have to take. If they don't take them, then that's an issue. That's easily managed. Doesn't matter whether they're right next to them or 10 miles down the street. So telework means nothing about customer service. Actually, if you want to end telework, it's actually going to reduce customer service. It's going to make it worse. Why? 55,000 these employees are already strapped out. They're at a 50-year low in terms of staffing. They've got too much to do. They got the baby boomers coming up, and they're just people leaving the agency left and right. Some people, the only reason they're there is because they're allowed to telework. They moved or something like that. If you force them to go back in the office, they'll say, "Okay, well, yeah, that was the nail in the coffin. I'm out of here," and that's actually going to reduce the workforce even worse, and therefore customer service is going to get worse as well. And I would argue that's probably the intent of this person. So he's trying to make a political point by, you need to return to work. These people are working. They can't fight back because they're not supposed to talk politics, but I'm retired, so I'm going to stand up to Clay Higgins for the 55,000 Social Security employees. They are working. They're just working from home. If you force them to go back to work, fine. If you want to do that, that's fine. But understand that's just going to reduce customer service and it's not going to solve it. So you're just giving a misdirection. You know, you know, Politicians love that misdirection. Oh, the reason customer service is so bad is because they're not at work, which is 100% incorrect. They are working. They just happen to be teleworking, and they're fully monitored. We've got systems, to track everything exactly how many appointments they're taking, whether they took their appointments, whether they're answering the phones. So that is not an issue. So again, he just gave $20 billion to a very few retired government employees for political reasons. He should have gave that to Social Security so they could actually hire people. But the problem is, well, one of the problems, if you give Social Security that money to hire people, customer service is actually going to get worse for 6 months to a year because it takes a long time to train someone. They're in training pretty much 40 hours a week for about 3 months, and then their claims are reviewed 100% for about 6 months to a year after that. So unfortunately, we need to get hiring people at Social Security immediately, if not sooner, if we actually want to improve customer service. But I would argue that he is just like a typical, kind of a CEO that says, if you don't give me these tax breaks, then I'm going to have to fire all the workers. Think about my workers. Think about the employees. Think about the workers. Think about the children. So give me these tax breaks. And then they get the tax breaks. And what do they do the next day after they get the tax breaks? They, close down the factory and send it to Mexico or China, whatever the case may be. So this is the situation that it just misdirection and say it's all about telework, but it's not. Um, he just wants to destroy customer service. There's a lot of, out there behind supposedly supporting elders, but he's not supporting elders. He is trying to diminish customer service. And this is a long time strategy. I've talked several times about this in my videos about this, a long term strategy. They've tried to privatize Social Security in 2005 under President Bush. They were unsuccessful. So they knew they needed a long term PR campaign to make people hate Social Security. And how do you hate Social Security? Well, you have to sit on phone for 3 hours. And so if we give up to it, if we buy, this plan that they're doing, then they win. But if we say, wait a second, I know why they're not picking up the phone is because they don't have anybody on the other side of the phone to pick up the phone. So you reach out to your politicians and say, hey, what are you doing to support the customer service in my local office? And what are you doing to make sure I don't get cuts in the future? Because we've only got a handful of people that are going to decide this. And this is the time to activate and get these people to actually support Social Security rather than doing all this political. Anyway, all right. So let me go ahead and get into all y'all questions here. And part of my, if you're new to my channel, my mission is to help you get all the benefits you're eligible for, all the benefits you're entitled to, all the benefits you've earned, and also to make sure those checks don't stop in the future. So that's why I did that little segment there. We need to support Social Security. All right, let's see here. It was supposed to be covered 100% under medical dental. Now they say they don't have any oral surgeon for medical. Medicare told they have to cover medical. All right, yeah, original Medicare does not cover dental as we know dental. If you have some, terrible accident or something like that and your, facial reconstruction, then part of that is covered by Medicare because it's part of a larger thing. But yeah, original Medicare does not cover dental, vision, or hearing, which I think we need to change. I think original Medicare should, how healthy are you in retirement if you can't see, heat, or, eat or hear? All right. So yeah, we definitely need to change that. Let's see here. Got the SSA called me today to get clarification on work history. The rep also said it's the final step before a decision. Is that a good sign? I have MS on state disability and a recipient of IHSS. Okay, yeah, I think you asked this. It sounds like a familiar question from yesterday. IHSS is in was California receiving money, so that's considered work. So you have to make sure you tell them that you're working, unless you are you're not the caregiver, you're the receiver IHSS. Then if that's the case, then you're good. But if you're the actual person receiving money from IHSS, you need to notify them. But yeah, what it is basically that you took your disability claim you in your local office, they send it to DDS, Disability Determination Service, and 6 to 9 months later, if you're lucky, you get the decision back because they're again low staffing. You get the decision back, and now the local office, they just do their final little checks that you didn't start working last week or 2 weeks ago, and start making $10,000 a month or stuff like that. So yep, that's the final step. And if you hired a lawyer or something like that, they'll have to pay the lawyer and all this other kind of stuff. So um, Stacy, I need to know when my husband should file for his Social Security. His FRA is in July. Yeah, you can file anytime. Um, your his full retirement age is in July, so he can actually start his benefits in January if he wants. If he wants, be reduced a few months, but you also get those checks ahead of the game. Some people do that if work is not an issue. This year you can make $62,160, and every month in the months before you hit your full retirement age, starting July, he can make $1 billion a month. It doesn't matter. Social Security doesn't care. But if he wants to start his benefits at his full retirement age in July, yeah, a couple 3 months before is plenty of time. Go online. Number one thing is to check your earnings record. Make sure he checks his earnings record to see if there's any mistakes there, because that's how they're going to decide how much he makes for the rest of his life. If he was born in the United States, probably won't need a birth certificate. If the name is right and the date of birth is right and everything. If born overseas, then might have to probably need a birth certificate, and obviously any type of legal status in the United States. But other than that, good, good, good. If one last thing, since he's his full retirement age, if he's already receiving Medicare, to turn on the money is so much easier, because when he filed for Medicare, if he filed for Medicare at 65, then he already did his proof of age and all that kind of stuff and set himself up in the system. So to turn the money on, the monthly benefits will be super, super, super easy. So because you already did the difficult part. If he is going to continue to work and have health insurance from work, then just refuse the Part B of Medicare. If he wants to start Part B, then he has to, figure out what he's going to do to cover all the gaps of original Medicare, the gaps of Part A, the gaps in Part B. So a Medicare supplement plan, Medicare Advantage plan. I always recommend checking out a Medicare supplement plan first, a Plan N or a Plan G. Look at those first, and if it's not for you, then move on down to a Medicare Advantage plan, and you can reach out to Chapter, and they can find out what's available in your area, including a Part D plan as well, and they will get you all set up 100% free. I am 60 years old and have not obtained American citizenship yet. I still have a green card, and for health reasons, can I obtain SSI? Yeah, it really depends. SSI is a welfare-based program for low income, low resource, if that's the one you're talking about. If you're talking about just regular Social Security, that's a whole different ball of wax. Yeah, if you're 60, the only thing you can collect at 60 is either disability if you're disabled, or survivor benefits. Other than that, everything else starts at 62 years old. I'm in the process of applying for SSDI. I have an event on 1/24. I currently receive Cal SSDI ending 3/25 and Medi-Cal. Okay. All right. So yeah, definitely get that application. If you're filing for SSDI, Social Security Disability Insurance, make sure you push the button by the end of the month, and that way you're protected for January. If you don't push the button until February next month, the fall, whatever, March or whatever, then that's when they potentially will use a start point for your benefits. So it's important that you get it done sooner rather than later. Okay, and here's a follow-up question. Does the date for SSDI need to be the same as Cal? Yeah, the Cal SDI date or the original event date. If SSDI is approved, will I need to pay back the Cal SDI and Medi-Cal already received? Yeah, that's the Cal SDI and Medi-Cal. That's, you have to talk to them, but Social Security doesn't require you to pay back anything or anything like that. Um, if that Cal SDI is a workers' comp type thing, there is an offset that Social Security uses. But in terms of the event date, which is your AOD, which is your alleged onset date, when do you believe your disability began? And remember, for Social Security, your disability is, when were you first unable to work because of your disability? So whatever that date is, that's the one you use. Let's see here. Other questions. True, new to Medicare Part A and B and Supplement Plan G, received a letter from Social Security stating they paid my Part B. Can I still wait till FRA for Social Security benefits, or will I be forced to take Social Security? Okay, good question. Yep. So number one, you did the right thing for getting a Plan G. If your budget can afford the monthly premium of a Plan G or a Plan N, then I would recommend that. That way you don't have the prior authorizations and limited networks and all that other stuff. But unfortunately, 50% of the people get Medicare Advantage plan, and I know why. A lot of those because they can't afford the monthly premium. But if you get sick, that might actually save you money. But anyway, some people just can't afford it, a monthly premium, so they kind of roll the dice type of situation. And a lot of others, because the people they talk to, the Medicare insurance agents, make more money when they enroll you in a Medicare Advantage plan. So they push Medicare Advantage plans because they make more money. It's good for them. It's not necessarily good for you. So that's why a lot of people get a Medicare Advantage. But anyway, all right. So you did the right thing, but I also want to see in there that you also signed up for a Part D plan, the prescription drug plan, and don't say that, well, I don't need it because I don't take drugs. No, I understand. If you don't take drugs, it doesn't matter. You still have to get it. Get the cheapest one, in your area, because if you don't and you sign up for a Part D plan later, you're going to be penalized for the rest of your life. 1% for every month you did not sign up for Part D. So, but I'm sure you did that. So good, good. All right. So yes, your Part B starts, and you for your actual Social Security monthly benefits. Yeah, you can wait till you're full retirement age. You're 70 years old. Don't wait till after you're 70, because your benefits stop going up based on that. Delayed at the month you turn 70. So yeah, absolutely. You don't have to start your benefits now. Start at your full retirement age. If you wait until 70, let's say your full retirement age is 67. You wait until 70, that's another 3 years. The delayed retirement credits is 8% increase every year. So if you wait the 3 years, then you get an extra 24%. But as everything else with that, the when you should start really depends on you, your health, longevity in your family, whether you need the money and all that kind of good stuff. Yeah. But yeah, you don't have to start your money now. Eric, I read that as Erica Badu there for a second there, but anyway, that's a whole on and on and on and on. I'm starting Social Security in May, 62 years old. I'm sick. My 60-year-old wife stays home as a caregiver for a disabled adult child. Can they apply prior to May? Will my wife be eligible for Medicare prior to age 65? All right, a lot of questions there. So you're starting yours in May, 62. Your wife's 60, she's a caregiver for your disabled adult child. Okay, so when you file for benefits, wait a second, disabled adult child. In order for a disabled adult child to receive disabled adult child benefits, one of the parents has to be receiving benefits. So is this another parent perhaps or something? That something doesn't make sense there. But anyway, let's say you start your benefits at 62, and then okay, let's say your child is receiving benefits from another previous spouse. Okay, so when you file for benefits on your record, then your disabled adult child sees if there are more benefits on your record versus their other parent. And then if so, then they switch benefits to yours. So they get disabled adult child benefits on your record because there's more money. In terms of your current spouse, if they're staying home to take care of that disabled adult child, they could be eligible for auxiliary child and care benefits. And in terms of Medicare before 65, no, unfortunately. The only people that can get Medicare before the age of 55 is if you're on disability. Yep. Rod Carver, thank you so much for helping your fellow man. You provide so much value. We appreciate you taking the time to do this. I have a couple of questions so far. Okay. Yeah. Thank you very much. I appreciate it. The first year I did this, I didn't talk anything about necessarily politics. I I'm not Republican Party, Democratic Party. I'm the Social Security Party. I'm here to make sure Social Security. So if I've criticized Biden, I've criticized Trump, I've criticized everybody if they do the wrong thing. So for first year I did this channel, I didn't talk about that. I just talked about your benefits and stuff like that. But since cuts are happening, that's your benefits. So unfortunately. These are frightening times. Yes, yeah, we really gotta, it's incumbent upon us to get up there. Okay, I already answered that one. Lisa, thank you very much. Nelson, this information is necessary for us to have available. If you haven't done so already, yes, hit the likes and thumbs and all. Yes, please. That's how this channel goes out to more people. We teach this crazy algorithm. Whatever platform you're watching this on, press like and subscribe and share and all that kind of good stuff. There's too many people out there because cuts are happening right now. People are saying, oh, the cuts aren't going to happen. Sorry, you haven't been watching this channel. The cuts are happening right now because people aren't able to get the help they need because politicians don't want you to get the help you need to get benefits. They want you to hate Social Security. So when they come up and they say, hey, we've got a white knight that's going to help you out, and they're called my friends in Wall Street, the billionaires, we're just going to give all your money to them. And people say, well, Ed, you're a fearmonger. Check out the video I did a few weeks ago, senator from Louisiana that said he is going to be introducing exactly that bill in Congress to privatize Social Security. So anyway, Christine, I'm wondering, I filed at 62. I'm now 71. I've been told I can refile for the deemed filing, which would give me my husband's Social Security amount at 67 when he filed. Okay. Yeah, I don't know about the deemed filing and all that kind of stuff in your particular case. When you file, that deemed filing basically says you have to file for any other benefits you're entitled to on particular situations. But if you're 71 now, and so your current husband, if your current husband has started benefits, then you need to file for benefits on those record. If there are benefits available there, in the sense of your full benefit amount is less than half of his full benefit amount. If that's the case, there might be some extra money there, but because sounds like he is your current spouse, he has to file for benefits, and it sounds like he already filed. So maybe the thing you're talking about, the deemed filing, is that you should have filed when he was 65, and if that's the case, Social Security often misses this one. You can do kind of the deemed filing and says, "Oops, I guess I should have filed when he filed. My bad. Can you go ahead and make that so now?" Maybe that's what you're talking about. So I would definitely go out there and reach out and say, "Hey, I want to file for benefits on my husband's record. I should have years ago. Can you deem me?" And say, "You're bad. You should have filed years ago." And you're like, "Oh yeah, you're right. Sorry." And they will give you all that money back. So. Call politicians and tell them to raise or remove the cap. Yes, please, please. Let me throw up our call to action there. Let me get rid of this. So yes, reach out to your senator, your representative. There's the Capitol switchboard, or call their local office where they're at in your neck of the woods. Call the president. Go onto their websites. Go onto their social media. Visit their local office. Reach out to the local news. And tell them to smash the cap. People that make over $176,100 do no longer pay into FICA like the rest of us. They pay the first $176,100, just like we do. Every dollar they make, they pay into FICA, Social Security. But after that, they stop paying into it. And that's the reason Social Security, one of the main reasons Social Security is going to get cut in the future. And then say, hey, what are you doing to improve customer service so people are able to get the benefits they need right now? And what are you doing to make sure the cuts are not going to happen in the future? The next President-elect Trump, said he's not going to cut benefits and he's not going to raise the retirement age. Perfect. Awesome. But what's the solution to make sure those cuts don't happen in the future. I haven't heard anything like that yet, so I'm still waiting for that. Um, let's see. Somebody's in Louisiana. Yeah. You've got, was it Kennedy there that started the whole internet myth about 6.2 million deceased people receiving Social Security benefits? He didn't specifically say that, but the way he phrased it, he knew people were going to, you know, jump on that and misunderstand it, and that's exactly what he did. And then you've got the other senator, the Cassidy. He's the guy that's going to introduce he said he's going to introduce a bill to give $1.5 trillion of the Social Security Trust Fund to Wall Street. And then, yeah, so. All right, let's see. I am 65 and retired, not on Social Security. I am on my wife's insurance until she decides to retire. My question is, do I have to do any Medicare sign up right now? No, absolutely not. If your wife currently has health insurance from work and you have that health insurance from her current work, and her employer has 20 or more employees, the group health plan that she has 20 or more employees, then you're good. You don't have to do anything. If you're happy with it, check to see what, if it's a terrible plan, it's costs you a lot of money, then you might want to switch anyway. Sometimes the employers want you to sign up for Medicare. They entice you to sign up for Medicare so their company can save money and all that kind of stuff. But you need to reach out to them about that. But no, you don't have to do anything. If you're not receiving monthly benefits right now, then nothing. You just continuing on. If you are receiving monthly benefits, then they will sign you up for Medicare automatically, Part A and Part B, and you just follow the instructions in the package they sent you, and you just return your Part B card. Yep, easy, easy, easy. And then when your wife, how did you put it? When she decides to retire, yeah, 5 years and 10 years, 20 years from now, when she decides to retire, then y'all go ahead and sign up for, Medicare, the other Part B, and get a Medicare drug plan and, supplement or advantage or whatever you want to get. And there's no penalty. Because you had credible coverage. Oh. Every politician knows what they're talking about. It's a deliberate act with intentions. Yeah, yeah, yeah. I have to give him the benefit of the doubt that he's not stupid. And so if I have to give him the benefit of doubt, I think he knows exactly what he's talking about. And yes, fear mongering, clickbait content. You do not need it. It is your Social Security process is good. I don't know about fear mongering. I mean, read the reports of all the reports in the description of YouTube that the cuts are going to happen. And in order for them not to happen, we have to hold our politicians accountable. So. Filed early for Social Security retirement benefits. Received my first check November 2024, second check December. I work part-time. Will they switch me monthly earnings cap over to annual based earnings cap after 125? Yes, yes. Basically, you can only do the monthly earnings limit thing the first year you start your Social Security benefits. After that, you go to an annual. So this year you have to stay under $23,400. Anything over that, they hold back $1 for every $2 you go over. And you can make $23,400 on January 1st in one day, and then not work the rest of the year. Or December 31st. It doesn't matter when you earn it. It's an annual earnings limit. So. Mary, what's up, Mary? My mom is receiving Social Security retirement on her own contribution, her husband on his. His is higher. Can she file under his since his is higher? It has to be quite a bit higher. It has to be twice as high as his. But be careful. Don't look at the MBA. Look at the PIA. What is the MBA? That's the monthly benefit amount. That's actually how much they're, getting direct deposited. Don't look at that, because one might have, started benefits early, or in the other one, gets Medicare taken out. So those are not the numbers you look at. You look at the PIA, the primary insurance amount. That's the amount your mother and father would have received at their full retirement age. That's the number Social Security goes by. And if you say, well, they don't know what that number is, then yeah, you call the 800 number. And both of them sitting there, and you say, hey, she says, hey, can I get any money off this guy? And they'll check, and if there's more money there, if his is twice as amount as hers, then they'll set up an appointment. And while you're waiting for that 3 hours to get in, I mean, Higgins was completely right. Yeah, it's unsatisfactory. This is not the way we need to take care because you paid for that. You paid for customer service. You paid for Social Security to answer the phone. You paid for Social Security to adjudicate your retirement claim or your survivor claim or anything like you. You already paid for it. All of those decades you paid into FICA, part of that goes to say, hey, this is the money I want to get when I get in retirement, but a small percentage of that, usually about 1% of that, goes to get help getting those benefits when I turn 65 or 67. But s- politicians are supposed to, give those resources to Social Security so they can pick up the phones and help you, but they don't want to do it because they want you to hate Social Security and just say, yeah, whatever, do whatever you want with Social Security because it sucks anyway. So if that's what you do, if you just kind of give up and throw up your hands and say, forget about it, then their plan has worked perfectly. And right now it is working very, very well because people hate Social Security. But it's, anyway, it's kind of like, if his last name was Walton and he, owned the Walmart and it's like, okay, you have two employees, you have a manager and one employee. And it's like, hey, how come you're not checking people out? Because we only got two employees. Can we get some more employees so we can, stack the shelves and, open more registers? No, no, no. Just move for someone from here to the produce or bakery or stuff. But what about the checkout? We'll worry about that next week. Yeah. So that person would be fired in no time. Um, all right. I'm 57, disabled on SSI in Minnesota, filing for DAC survivor benefits. If I get it, I should get the full dollar of parent. What happens when I turn 62, 67? All right. No, you won't get the full. You'll get 75% of that person's full benefit amount, up to 75%, unless there's other children or something like that. But probably it doesn't sound like there is. But yeah, you'll get 75% of their full benefit amount. And what happens when you turn 67? Nothing. No changes. You'll continue to get that for the rest of your life as long as you are disabled. And disabled adult children, if you get married, those benefits will stop unless you marry another disabled adult child, another DAC. So exceptions, exceptions, exceptions. My birthday is the 29th of the month. I am retiring in April. Will my first check be on the fourth Wednesday of May? That is correct. Yes, because you were born at the end of the last 10 days of the month. You'll get your check on the fourth Wednesday of every month, and it's always paid. Yeah, um, the the April check comes in May. The May check comes in June. Yep, that's it. Let's see. I love your information. Thank you. My husband passed away at 62 in 6 months, never filed for Social Security. When I reach FRA, my husband would have had passed 70. Will I collect the maximum of his PIA or will I get DRCs on this? No, because he did not wait. If he was 70 when he passed, then you would receive the delayed retirement credits, but he did not. So you'll get 100%. So if you start your survivor benefits at your full retirement age, you will receive 100% of his primary insurance amount. Yes. Let's see. All right. My husband, fireman for 20 years, did not pay into Social Security. With Fairness Act, his PIA is lower than mine. I'm on SSDI, survivor benefits all denied. Is this correct? Well, as last week, yes. But since they passed the Social Security Fairness Act, which I would argue is not fair to the other 97%, then everything changes. Make sure you watch the video I did 3 or 4 days ago on it's a critical update Social Security Fairness Act. And I go into great detail and people say, oh my gosh, this is the most confusing video you've ever done. And it's unfortunately, there's no way to make it unconfusing. So I did my best though. Who is lobbying for an increase in the income ceiling? Might that help extend the life of Social Security? Also, why shouldn't people have the right to put a portion of Social Security into other investments? Yeah, I mean, I ask that all the time about, you know, people say, well, Social Security has a terrible return on investment, and I could have done a lot better. And I was like, well, it was 6.2, so I'm sure 10% save for retirement. So that other 4 or 5%, I'm sure you make millions of dollars there. And their response is, oh yeah, no. So yeah, but in terms of who is lobbying for an increase, President Biden, Vice President Harris, Bernie Sanders, Elizabeth Warren, Larson. There's a lot of politicians that want to increase. President Biden and Harris's plan was to, what was it, up to $250,000. You pay, you know, every dollar you get, you pay your FICA Social Security, and then from 250 to 400,000, there's kind of like a donut hole where you don't. So I think that was a political thing to, so it wouldn't hurt middle class as much. And then from 400,000 on, then you pay FICA just like everybody else in the country. But unfortunately, they lost the election for that, because I support that one. I don't, whatever politician wants to do that, then I 100% support him, because I'm a one-trick pony in terms of just trying to help preserve Social Security. I saw him yesterday. I'm so glad you're addressing this. I thought the same thing. Either he doesn't know what he's talking about, or all this is show, blaming the employees. Yes, it's all show. Again, characterizing them as, if they don't come back to work, oh, they'll be fired. Well, they are at work. They're just, not at the cubicle. There's this thing called the computers and the internet and technology. And but that's what he wants to do, is fire as many people as possible. So y'all really hate Social Security then. So I worked hard, so don't shoot the messenger. I worked hard at the post office. Most of my coworkers did. There are always a few in every type of job that don't want to work. Yes, exactly. Oh, that's another thing. Thank you for that, Shelley. So he should not say just federal employees. Yes, thank you about that. I forgot about that part. That yes, every organization has bad employees, but Social Security, they can't hire people because they have to get allocations from Congress. Congress has to say, okay, hey, you need more people answering the phone, so here's some more people to answer the phones and help with disability and retirement and survivors. Okay, awesome. But they don't do that, so there it is. And the substandard, I'll put it nice, the sucky, the terrible. Okay, I'll pull out my old Marine Corps sergeant vocabulary. Not that bad, but anyway. But the really bad employees, it's difficult to fire them, not because they're federal employees. It is a little bit difficult, but it's possible. I've fired a lot of federal employees. But the managers of these offices can't fire those employees because, let's say you've got an employee, all the employees in the office are 100%. They're, kicking on all cylinders, but there's one employee that's, 70%. For whatever reason, they're just only producing 70%. And you're like, wow, I need to get rid of that person. That, they're just holding everybody down. So I want to fire that person. But the issue is, you fire that person, you can't replace them. If you could replace them, then more federal employees would be fired. So if you had if you went into an office and someone was rude to you or something like that, I'm sure there's a district manager that's saying, I would really like to fire that employee. But if I fire that person, I don't get a replacement. And because I don't get a replacement, I have to kind of tolerate 70%, because they are producing 70%. They are helping 70% and answering the phone 70% of the time, or whatever the case may be. But if they fire that person, they'll get 0% done. So if Congress would say, okay, you can hire people, then the first thing Social Security managers throughout the country would do is says, okay, we just got some people hired. Let's train them for a few months, and then you're gone. So, but so they can't hire people either. Yeah, it's they can't fire and they can't hire. So it's kind of a tough situation. As long as they turn in their stats, they should be able to work at home. Exactly. And they don't even have to turn it in. It's all, got this thing called the computer. And I had 4 monitors. I had a VIP on one, and I had the phones on another, and I was doing work on another. And so I was watching everybody, and it's like, hey, and I'd send them a little blurb and says, hey, how come you're not on the phone? So how you're late on this appointment. Oh, this previous disability appointment took a lot longer than I thought I have. So, okay, all right. So go ahead and, finish that, and then make sure you call your next appointment and stuff like. So yeah, that's super, super easy. But, and he knows it. He knows it. If he ever visited a Social Security office and actually, talk to Social Security employees, but he doesn't want to. So if he did, he's just ignoring what they said. My sister is disabled and receives Social Security and survivor benefits from our father. She will turn 62 in March. Can her disabled son receive survivor benefits from her Social Security? No, because she's still alive and kicking. The only time can receive survivor benefits is she's actually receiving survivor benefits. However, the disabled son should be receiving if disabled, the disabled son should be receiving benefits on her disability benefits claim. He can't receive survivor benefits from his grandfather, but he can receive auxiliary child auxiliary child care benefits, not care, just child benefits from his mother because his mother is receiving Social Security benefits, disability benefits. And the fact that she's 62 is no relevance whatsoever. Not sure why the child is not receiving benefits already. If the child is under 18, easy, easy, easy. If the child is over 18, then he needs to file for what's called a disabled adult child benefit. And that basically you have to prove to Social Security that he became disabled before the age of 22. So, yes, please make sure she reaches out. Unfortunately, you can't do that type of a claim online. Make sure she reaches out to Social Security and files a disabled adult child benefit for him. The reason there is less government workers, less service is because you voted for less government. Yeah, and it's going to get a lot worse. And anyway, yeah. So I'm so sick of the whole system. Yes, but that's the one of the secret weapons of politician is to build cynicism to just say, forget about it. Whatever happens, happens, and that's when they win. So we have to persevere. I just became eligible to start Social Security. Should I know about actually taking Social Security? Yeah, I'm not sure, Robert. Um, So yeah, you should definitely educate yourself about Social Security. I guess if that's what you're asking. So you just became eligible in the sense of you just paid your 10 years or 40 quarters, or you just turned 62. Yeah, definitely watch. I've got close to 1,000 videos. Watch my videos on early retirement and all that kind of stuff. Yes. Um, Ed, start a company to train Social Security employees. Yeah, well, they do a great job of training employees, but one of the problem, but there are 20,000 pages of policy, and well, they don't do it. Let me take this back. If they had the time to train the employees, then the systems that they have to train employees is a good system because I use that system for hundreds of my employees, and it's a good system. I like to change it a few places, but I'm sure they've already thought of those ideas. But the problem is now the reason the employees aren't getting the training they should is because they don't have time to do training because they've got to answer the phones as best as they possibly can. They have to take the disability claims and retirement claims. So in my office we did more training I think in my office than we did in any other office in the country. We had regular, really good training sessions, extra training sessions. So but yeah, now would probably be difficult to do it like that because the workloads. You just don't have time to stop and say, okay, we need to fix this. But yeah, yeah. What about when those politicians who are supposed to be in Congress to represent the people and they're absent from doing their job? Yeah, yeah, exactly. They're out and about and taking tours across the world and stuff like that. It's like you need to go back to your job. It's like, oh well, I'm on the phone or going golfing. And let's see here. So some about telework. Telework is fine as long as people get through on timely manner and get accurate information. I agree. Yeah, I don't. I'm teleworking. I guess right now, so not an issue. But if you think it's an issue and you need to come up with stats that say but again, that's not the solution. That's a red herring, misdirection. So. Doc, don't you know if you got my question? When should my husband file for Social Security? His files in July. Yep, I already answered that one. Yep. Waited on the phone yesterday for 3 hours and 37 minutes just to talk. Ridiculous. I agree. 100% ridiculous. And I'm sure whatever office you called was not happy. They hate it too because, when you do get through and you're angry and frustrated and you take it out on the person on the other end of the call that it's not their faults. It's they just don't have other people helping them. So yeah, say, hey, let's be polite and nice. If the Social Security employees is not polite and nice or rude or something like that, yes, please, please, please complain. Um, but unfortunately, if you do, then if that employee is just really, really terrible, then if you complain, that might be the third strike, so they can get rid of that employee. But unfortunately, sometimes there's like, yeah, I know this person doesn't have the best bedside manner, but I can't hire anybody else to replace them, so I just have to tolerate. It's yeah, that's I yeah. Don't give in to politicians. Wait all the time it takes. As Ed said, call your congressman and tell him straight out. Get the word out. Yes, while you're sitting there on the phone for 3 hours, um, open your laptop there and go on to your two senators, one congressperson, House of Representatives, and for that represents your district. Go onto their website, and it has a little button that says, "I need help with a federal agency." And click on that while you're sitting there, listen to the music, and say, "Hey, what I need help with Social Security. What help do I need? I need them to answer the damn phones." And I know it's their not fault. I know it's not their fault. They just don't have the staff. What are you doing to make sure they they have the resources? Just like any Starbucks or Walmart or wherever the case may be. How come you don't have more people at the checkout line checking people out? Well, we just don't have the staff. Well, that's your responsibility. If you don't have the staff, then you're a bad manager, bad owner, or whatever the case may be. But Social Security can't hire more people. Say, why does Social Security hire more people? Exactly. That's exactly it. Why doesn't Social Security hire more people? Because they can't. Because Congress controls the budget. They control the purse strings. Social Security can only hire when Congress says, here, hire. But Congress is refusing to do that because they don't want you to get your benefits and they want you to hate Social Security. Wayne, I'm 64 and began taking Social Security last year. I'm considering suspending my benefits to take a full-time job. Would I need to repay all benefits, paid benefits? No. If you say suspending, no, you don't have to. If you started benefits last year and it's under 12 months, then you can withdraw your application and say, hey, like it never happened, but because it never happened, you do have to pay all your money back that you received. But doesn't sound like that's what you're talking. You're talking about suspending your benefits. Yep, you can do that. Just call Social Security, do a work report, and say, "Hey, I'm going to be making 50, 60, 77, $100,000 or whatever the case may be," and they will suspend your benefits. So easy, easy, easy. And then once you hit your full retirement age, then you can restart your benefits, and they will unreduce your benefit amount. So if your benefits are reduced by 30 months because you took them 30 months early, but then after 10 months, you go back to work and your benefits are suspended for the other 20 months. Once you hit your full retirement age, they will readjust that. The computer completely automatic. The computer system will look at it and say, "Hey, Wayne is reduced for 30 months, but he only took 10 months of those. So we're going to give him credit back for that 20 months. So basically, going forward for the rest of your life, your monthly benefit amount is only reduced for 10 months. The number of months you actually took benefits. So all right. Let's see. I'm jumping around here a little bit. Got a lot of questions, so unfortunately I'm jumping around a bit. At age 60, my dad, deceased now, had me use his Social Security number to get a job. I did that for 2.5 years. Now that I'm able to get Social Security, I'm short on quarters without those 2.5 years. Can I get them back? You would have to prove it. So yeah, which might be difficult since it's so long ago. But yeah, you would have to prove that those weren't his earnings, and yeah, it's possible, but probably it's going to be difficult. Obviously, come up with any type of proof or something that was actually your work, that you were the actual one that showed up to work. So, but if you do, yeah, then they can transfer those earnings from his record to your record if you're able to prove it. Patty, I have been collecting Social Security since age 62. I will fully retire on January 31st. My company wants to give me a bonus, 100K. My FRA is 67 in 2 years. What will happen to my benefits? So you've been collecting since 62. I will fully okay, so you've already been receiving benefits. Um, so yeah, if you're going over that, it really depends how you and your company categorize that. If it's actually wages or something, or if they put it into a 401k. So it really depends between you and the IRS how you and your buddies at the IRS categorize that $100,000. But if it's actually W-2 wages or net income from self-employment, then that's how the IRS will notify Social Security. And yeah, and if you're yeah, so yeah, your full retirement age is not for 2 years. So yeah, you're gonna be overpaid. It looks like. So I would call Social Security if you're gonna list that as regular wages. Then I would call Social Security and say, "Hey, stop my benefits this year. I'm gonna make too much." So what's new? All they care about is their own pockets. Yeah, that's um, Dana, can SSI beneficiaries collect both their SSI benefits and half? Okay, you don't mean SSI. SSI is the welfare-based program, supplemental security income. You mean just regular Social Security. Okay. Can Social Security beneficiaries collect both their benefits and half of a divorced husband's benefits, like SSDI can? Probably not, but I thought it couldn't hurt to. Yeah, yes. For SSI, for regular Social Security, yeah. If you receive benefits on your own record, and if your divorced spouse's full benefit amount is over twice yours, then yes, you can collect essentially the difference. One offsets the other. But yeah, absolutely. As long as your ex-spouse is at least 62 years old. The new administration is filled with billionaires. The elderly, disabled, poor, are doomed. Good luck to you all. Yeah, there's a lot of bills being passed in Congress. There was a wish list I did a few days ago about, disability return to work, Medicaid, SSI. So I'm going to keep you all ahead of all that, and so we can take action. I'm collecting Social Security at 62, starting in May 2025. Can I start collecting 3 months early as well? Yeah. Well, wait, no, wait. You're 62. You can start your benefits in May if you're 62 the entire month. So the first month you're 62 the entire month, you can start your benefits. Can't have it both ways. Congress either allow hiring or suffer the political or other consequences of not having sufficient staff. Yeah. Yeah, it's not rocket science. It's like any business in the country. It's like, how come you don't have people, make my hamburger? Well, I don't have, we're not allowed to hire anybody. So we got one person at the register and one person making fries, and we just can't hire a hamburger person. So um, 8% per year plus COLA. Yes. Yep. Yep. COLA is automatic throughout. So that's 8% for the delayed retirement credits. Yes. Suppose you have Plan G and your first two appointments of the year are both on January 10th. Each charges $500. How do you prove to the second doctor that you paid the first doctor the deductible? Um, oh, that's a good question. Yeah, because you only have to pay the one-time deductible. Was it $276 this year? I'm actually going to have chapter at the end of this month, within the next week or so. I'm going to have Thomas. He's the guy that's in charge of the people that help y'all find the plan, the Medicare supplement, Part D, Medicare Advantage. He's the guy in charge of the people that help you find a plan. And then I'm going to have the person from their member success team, is what they call it. The member success team is people that help you navigate all of the fun parts of your plan once you have a plan, and that's the type of question she's an expert in. But Oh gosh, that is a good question, the actual feasibility of, but I would probably just tell them, and if they don't believe you, just say, okay, well, if you're making me sign for it, and I'm sure they're probably got it in the computer system that they interact, that the premium has already been paid, that the deductible has already been paid. But if not, and they force you to do it, I guess you can, but if you want to be, don't want to cause an issue, you just go ahead and pay it, and then you'll get that money back. So Um, the House has its smallest margin since 1931. It's going to be interesting to see what happens in the legislative branch. Yeah, there's some interesting language. I just did a video about a week ago about some interesting language, the new House rules that are trying to manipulate the system, through reconciliation, and that they don't, need a 60 vote, and they can override, filibusters and all that stuff. So, yeah. Why was 87,000 agents hired for the IRS instead of Social Security office? Yeah, I agree. I think Biden should have, balanced it out a little bit. I understand IRS, hopefully they don't come after us little guys. It's easier to come after us little guys because our tax returns are so easy. Oh, you said you paid charity $5,000 in charity, but I don't see. Yeah. Anyway, but the big guys with all of their shenanigans and Cayman Islands and taking loans instead of taking capital gains, those take a lot more agents, and so yeah, I agree. They should have maybe balanced it out a little bit. Hello, Doc. I chose an Advantage plan which started January 1st. Am I able to switch to an N or G before October when we start up sign? You could very well, yeah. You chose an Advantage plan which started on January 1st. Um, Now is the time you might be able to switch out of your Advantage and return to original Medicare. Now we're in what's called the open enrollment period, which is January, February, March. So if you have a Medicare Advantage plan right now that you just chose or forgot to switch or something, and now you realize it's not for you, now's the time to do it. So if you call Chapter today, they can switch it for you, and you can only do that January, February, and March for this particular open enrollment period. And this is also the time to switch to get out of a Medicare Advantage and switch back to original Medicare. But you might, depending on your state and other factors, you might have to go through health and underwriting. So yeah, reach out to Chapter and they can help you with that too, and they can find anything possible that can help you get to where you want to go. Um, is it true that Social Security is informing Department of Education that I am on SSDI and qualify for student loan forgiveness? How can I make sure? Oh, I'm not sure about that. Whether they have any type of information sharing on the loan forgiveness for people on disability. Oh god, that's a good question. I don't think they do that automatically. I know Social Security is very tight when it comes to sharing your personal information, but if Congress allowed that, specifically said Social Security you can share that information with the Department of Education, then they are. But usually, from what I understand, everybody that came to my office about this, they always wanted a decision letter, an award letter that says that, you're on disability and therefore, whatever loan forgiveness. But I would reach out to the where you've got your loan and say, "Hey, what proof do you need?" And they'll tell you whether they'll say, "Oh yeah, we don't need it. Our system interacts with Social Security, so no problem." Or they'll say, "We need an award letter." And then you just get an award letter. So and then, yeah, once you, Melanie, do me a favor. Once you get that figured out, I'm almost certain. I'm at 99% certain you have to get the award letter and submit it. But if that has changed recently, Congress passed something, please let me know. Yeah, come back here and say, "Hey, Ed, I did this, that." Yeah. So, if I work at a county job driving a school bus, and I was in a union, I might have had a pension. Does others like myself get the raise? It depends which county in the country you work for. So yeah, the union is not an issue, but the county type thing, if the county you work for did not pay into Social Security, then that's one of the covered entities that Social Security Covered Act, Social Security Fairness Act was talking about. So, but if you paid into Social Security while you drove a bus there, then yeah, it's not part of that Social Security Fairness Act. So, all right. Unfortunately, I've got tons of questions and we are over an hour. I apologize. I will be back again tomorrow. And so please type your questions there and I'll answer as many as I can. Please share, like, and subscribe so we share this information with more people.